Hello, and welcome to another edition of this special webinar that we organize for mental health on behalf of all Mercy Psychiatry and Integrative care. Today is a special day. It is really a special day because we're going to be discussing and touching some really sensitive element or sensitive mental health issue that affects especially women, or most often women, during and after pregnancy. Our topic for today: postpartum depression, PPD, or you call it. Have you heard about this? Have you been a victim? Do you know someone who've suffered from this? I'll challenge you to tag that person over or under this post so that they can come and share their experience on the comment section. My name is Adlinsede Kamga. I'm going to be your host for today once more. And on the panel with me today, I've got three amazing women, which I'll be introducing to you just after this little break. Welcome back. Let me start by introducing our host for today, Dr. Mercy Psychiatry, founder and CEO of All Mercy Psychiatric and Integrative Care, based in Texas, but covering different parts of America. If you ever feel that you have a mental health challenge or you have issues regarding your state of mind, Dr. Mercy is a person you should be hooking up with. Next on my line, or next on the webinar today, is Kalia, who is a mental health coach. I believe she's also a truly resourceful person that you can connect with, just in case you think you want some questions answered with regards to your mental health. Kalia is a specialist with many years of experience, and she's been on a program before. So if you were blessed or lucky to have caught her speaking, then this is another opportunity for you to hear her speak again. And last but not the least, we're going to be meeting Jay Collins again. She's a student psychologist, and she has a wealth of experience, some real experience that she want to share with us today. So just over the break, I'm going to be introducing Dr. Mercy to kickstart this wonderful webinar that we've put together for you all. Have you ever been in a situation where you feel you do not love you anymore? Have you ever been in a position where you feel you're depressed because of how you look? Have you ever felt so sad, so depressed, anxiety after having a baby? Sometimes we have all sort of emotions floating, our heads, our minds, clouding our emotions when we've just had a baby. Sometimes it happens right before we have our babies, and we're not even sure what's happening to us. We're not even sure the state of mind that we have. I can vividly remember when I had my son, it was it was in May, and I had gone to the hospital telling the doctors, I don't feel right, I don't feel okay. I felt so sad. Yet again, I felt so moody, and I was diagnosed with what we call preeclampsia, or so they say. I was diagnosed with some health condition linked to the pregnancy, and I was supposed to be induced. I felt really sad knowing I was going to be induced, but maybe this was because I was going to be induced, maybe not. But I had to walk around the shopping center, just thinking, what's going to happen in there? You never know. And what's going to happen after? You never know. So luckily enough for me, baby decided to come on that day, and I wasn't induced anymore, so I had baby naturally. Post-pregnancy, of course, there's always that fluctuating feelings, you're feeling sad, you're feeling overwhelmed, you're feeling tired, anxiety. Sometimes we'll just think that our bodies, is reacting to the fact that we've already have our babies, but sometimes no, it is deeper than that. That is why we've brought together these three amazing women so that they can talk to us about postpartum depression and what it actually does to the body. They're also going to tell you the relationship between the social support, the relationship that you have, and how social support can help you. So if you're pregnant and you're watching this, or if you're experiencing all these emotional brouhaha while watching this, please do comment, do let us know how you feel, and we'll be happy to take any questions. Right now, let me pop on the screen our host for today, Dr. Mercy, who is the founder and the CEO of All Mercy Psychiatric and Integrative Care Limited, and she'll be talking to us about her practice, not just about her practice, but about the topic that we're about to discuss or digest. Hello, Dr. Mercy. I've popped you on my screen. How are you? I'm just going to unmute you. So if you can unmute yourself, that will be good. How are you today?
Hello. Echo. So excited to be today. How are you guys doing? Those who are watching, thank you. If you can share so that others can benefit from this information, we'll be grateful. I am Dr. Mercy, a doctor in nursing practice, a psychiatric mental health nurse practitioner. We talk about everything mental health. Me and my practice, All Mercy Psychiatry and Integrative Care. We talk about anything affecting mental health. And you'll be surprised that almost everything affects mental health. So we talk about everything. Most of the time, you guys give us topics and we talk about them. Nothing is off the shore, nothing is limited. We always relate it to mental health. Our last webinar was on generational traumas. Our topic today can also relate on generational traumas. Some people think that because my parents or my grandparents had postpartum depression, they just start getting scared of getting pregnant or what their own pregnancy journey will look like, thinking that they too will have postpartum depression. Yes, like our last webinar, generational traumas are real. It doesn't mean they follow us in the future. And if we are at high risk of those traumas, we can always take precautions so that we don't fall into them. We can always take care of them so that they don't follow us and follow the further generations. Talking about postpartum depression today is something that is so cherishing. I think all of us in the panel here today, we are all mothers. We can relate to it. Not saying that we have all had postpartum depression, but we have all met someone or counseled people with postpartum depression. It is funny how a moment of so much joy, you're bringing your baby, you're cherishing that moment. And at the same time, you're crying, you need help, you're turning into someone else that you yourself cannot even recognize sometimes. And people are asking, is postpartum depression real, or is it just the stress of the day? Or is it just the overwhelming thing going on when you become too busy? So I have some friends, colleagues, and workers here with me who would talk about postpartum depression. I'm sure this is going to be a very, very, very interesting conversation. Let us all listen, learn, share our input. We are ready to answer questions. And please share. Thank you so much.
Thank you. Wonderful. You've all heard from Dr. Mercy. This is a moment of sharing. This is a moment of you not just listening to us, but of you telling us, your experience. It's an experience sharing. I mean, it's the end of the year and we all love some giving. So whatever you give us today, please note that we're going to take that as an example, which we're going to hand over. And even if you're just an audience today, note that a lot of people count on the advice that you will put on the comment section that can help them go through, any postpartum depression syndrome that they might have. Next on the screen, I'm going to just add Kalia. Kalia Elliott, and she's a mental health coach. I love that, mental health coach. That means anything that has to do with your mental stability or your mental instability. You have someone that we are giving to you for free who can always advise you. So please do take note as I pop her on the screen that she is for you. Hiya, Kalia. You will need to unmute yourself.
Hello, how
Hello,
are
how are
you?
you? I could be better with the cold, but we're good. We're good.
Good.
Good. So tell us
My name is
about
Kalia.
yourself. Kalia.
Okay.
Okay.
There's a little bit of delay, but my name's Kalia. I am a mental health coach and also the director of peers services at Family Community Case Management. And of course, I'm a mother. I'm also a grandmother and a very experienced aunt. With many sisters who have gone through, their journeys with their babies, as well as I have with mine. Um, I take pride in helping others navigate serious times in their life, especially when they're having new babies. Not just so I can hold the baby. Let's just get that out the way. But so I can help the mom, even the dad themselves, navigate postpartum depression as somebody that has experienced it before herself.
Wow, Kalia, I think just to have you hold my baby, that will be amazing. So I wouldn't mind coming to you just to help me hold my baby. So thank you so much for joining us today. I think I'm really looking forward. We've got one more person that I want to pop on the screen today, and Jay has a bucket full of experience. At the moment, Jay is a student psychologist, but I bet you this conversation would not have held without Jay. Jay is la crème de la crème, as we say in French. I'm sure Jay understands what that means in English, the cream of the cream. So we're bringing in the last, who is la crème de la crème, because the experience that she has and just the fact that she said, yes, I'm going to be educating, sensitizing, and talking about this very, very important topic today with you guys. I just can't say thank you enough. Jay, thank you so much. Let me pop you on this stage so you can introduce yourself to us. Hiya.
Hello, everybody. I'm so happy to be here. When Mercy asked me to join, I was like, I don't know anything about this except that I've been through it. And she said, you don't have to, just that is enough. And I said, okay, I'm here. And I'm so happy to share my experiences because they were crazy. I am currently a student. I am so excited. My husband just graduated with his master's in computer science, and we're about to switch. I have been doing one class a semester since my child was about 8 months old, and I have accomplished basically nothing. My child is now 4, so we're working our way through. And it's my turn to be the full-time student and his turn to be the daddy.
That's a very functional family. You know what I mean? It is so functional. I think I want to say thank you to your husband for letting you do you, because having a husband who is that supportive is already the first step of mental stability, because sometimes it can get really crazy.
Yes.
Very true. So, ladies, now that we've done all the merry-go-round, as we put it, let's dive right into the first question. And I want to bring this first question to you. Let me start with you, Kalia. Tell us, what are some of the common physical and emotional challenges that women face during postpartum periods?
Oh, goodness. Okay. So, one of the challenges that women face is the change in their hormones. One, we're going from prepartum or antepartum, which is while they're pregnant with the baby and their hormones are already at a certain level. And then we're going to postpartum after the baby. And our bodies are still trying to regulate those rush of hormones that are going through us.
and then we have to deal with this little human that's brand new. And for new mothers, that's a totally different task of trying to understand how we function as a person as well as function with this baby. I'll deal with the unrealistic expectations that have been set by society to just snap back right after childbirth, which some cases that's very impossible without lots of rest and healing. If you have a natural birth, you still have to do some healing time. If you have a cesarean, you still have to do some healing time. And then, of course, there's lack of rest. There's lack of taking care of self. There is a whole gamut of issues that some women face during their postpartum periods. There's crying, there's feeling like we're not good mothers, there's feeling like we're not doing enough as mothers. There are the even overwhelming task of making sure that everything is done 2 days after you've had a baby. And that's kind of impossible at this moment unless there's a plan in place. So there's a lot of things I feel that mothers face, especially new mothers face when they just had their babies. I don't think we can hear you.
You unmute.
On mute. Okay. So what I was saying, I was just thanking you, and I was thanking you for explaining this in a very logical way. And I was asking Mercy, Dr. Mercy, if there is something she might want to add to this, so that we hear from a different perspective.
Yes, Kalia, thank you. Talking about the hormonal changes. You have hormones build up in your system for 9 to how many months, and all of a sudden that baby is gushed out, and your body is expected to just regulate itself, get in a chemical balance immediately. No, it doesn't happen immediately. It is taking some time, and different people handle it differently. Some people may go through that baby blues period longer than others, and you may be surprised asking yourself, what is happening with my body? It is the changes. It is the hormonal changes. Some challenges come with breastfeeding, which also come with more hormonal changes. Your nipple is sore, your breast gets engorged, it's hard, it's painful, you have fever, fatigue, just tiredness, sleep deprivation. When you want to sleep, maybe the baby is up, you're not able to sleep, visitors are coming, different things going on, you're bleeding, sometimes even heavier than your normal menstrual bleeding because things are getting back into place, changes in body image. Maybe some people are thinking, was that baby come out, you get your size 4 figure back immediately? No, you see your stomach still hanging. The body changes, everything start affecting you. Abdominal pain. So it is a physical and emotional healing. Sometimes even with natural birth, you still have some pain down there. You're trying to get healed at the same time while you're in pain. Sometimes you have changes in your bowel or urinary function. We've had women who even become incontinent for a period of time, up to 3 weeks to a month, before their system adjusts because they had a baby. They had to push that baby out. So many things get pushed out as well. You start having muscle ache, muscle pain. The baby blues, those mood swings that just come. You're tearful, you're sad. Sometimes you don't even know what's going on. You're happy that you have your baby. And people may think that, did you wanted to have this baby? You're happy and you will not trade that baby for anything. But it doesn't stop the fact that your physiology is going under some repairs. You get anxious, you worry. Am I going to be the best mother? This baby is crying. I've had diaper change. I've fed the baby. I've cleaned the baby. Why is this baby still crying? Is it because I'm not doing a good job as a mother? Is it because I'm not fit to be a mother? Adjustment issues start happening. Maybe it was just the two of you in your house, or maybe it was more than the two of you. But this small human, like Kalia said, this small, big human, big because it's controlling all of you in the house. Your whole timetable shift because of this new human who is present. All of you have to adjust your schedules, adjust your routine to meet up with caring for that baby. Sometimes relationship even changes. Your partner or with the other siblings, your relationship with them change because they feel like maybe this new baby is taking all of your time, and they don't, and you feel even isolated sometimes. So, well, some people may choose not to disturb you because they know what you're going through, but you may misjudge that, like, I need help. No, you start having guilt, you start having self-doubt. All those things add to this thing we call postpartum depression if not handled well. Thank you. Unmute.
I think I'm just gonna leave my mic. I'm gonna leave my mic unmuted. I think your explanation has brought me to some really tough questions. I'm gonna skip question 2 because I know that you've really talked about some of the symptoms and the signs. This will bring me up to J, because what Dr. Mercy has explained, I'm just wondering and I'm thinking, okay, as a mom of 3, maybe all the feelings I had during that time, I was suffering something bigger, something deeper. But can you tell me, please, Jay, from your perspective, what are some of the key signs and symptoms that you experience as a woman? What would you advise other women to be aware of, when we're talking about postpartum, depression or period?
My experience, I was like on the far end of not okay. The intrusive thoughts was so bad for me. I ended up actually moving my child's bassinet. Like, we spent so much, I have to just pause. We spent so much money on a beautiful nursery that is basically just a closet still to this day that we never, ever, ever used because my postpartum depression manifested as mostly anxiety. If she was not in her bassinet right next to me, I could not sleep. My logical brain felt trapped behind the thoughts of that. If she wasn't right there, if I couldn't just lean over and look at her or touch her, then she was dead. There was just no getting past that. And it was rough. And clearly that is not something that is normal. So there's a big symptom to watch out for. You might need to speak to your healthcare provider if you're feeling like your baby might be dead just because you can't see them. For me also, I wanted to touch on the breastfeeding. The breastfeeding journey, sometimes it doesn't work for people. Mostly, sometimes it doesn't work for people. There are so many cases where you are just in pain, you are not feeling well, and like the hormones that are affecting your milk supply are happy hormones. You have to be happy to be producing milk for yourself and your baby. And so if you're not feeling happy thoughts, if you are not okay, then that can affect your milk supply, which will then lead to serious mom guilt, which will then lead to you feeling like you're not enough and you're not doing enough for your baby. And like starting formula can feel like a huge failure. And it's just a vicious cycle. I'm just going to touch on my notes, see if I missed anything. No, that's it. That's what I wanted to touch on. Still on mute, girl.
How long were you depressed for? How long were you, in depression for?
It really felt like it until my child was about 2. I was able to breastfeed, and I ended up breastfeeding until she was about 2.5, which was a wonderful, wonderful experience for me. I loved every minute of it. I still kind of miss it sometimes, but I really do think, in hindsight, that just added, it just added to the whole mess, because I was experiencing all of these hormone fluctuations until she was about 2.5. And it wasn't until that time when we stopped finally that I started to feel normal again and start to be able to focus on anything outside of my little circle of taking care of my baby. I basically just made my master bedroom my little sanctuary, and anything outside the door I couldn't handle. Anything.
So tell me, what do you think, what was your experience like with healthcare professionals? What could they have done differently to help you? Because probably I'll say 2 years is wide. So what do you think they would have done differently to support you? Or what kind of support did you
I
get?
kind of have a funny story about this, actually. I had a natural birth in a hospital, but I was with midwives. It was a great experience. I really loved it, but I really did spend my whole pregnancy freaking out about giving birth in a hospital. I don't know, something just kind of got in my head that it was scary to do that. Blame Instagram. And I had nurse midwives in the hospital. It was a great, great experience, but there was not a lot of follow-up afterwards. I think I went back in to check one time and get birth control, and then that was pretty much it. My child's pediatrician, though, this is my funny story. For some reason, when we went into the hospital to have my daughter, we didn't realize that they weren't going to let us leave the hospital until we had a pediatrician appointment set up. So we were scrambling, and I kind of let my husband do that. I was like, listen, I just pushed a baby out. I'm not going to get on the phone. I'm going to sleep. So he found a pediatrician for us at 8 a.m. 2 days after we were like released from the hospital. So I went like 3 days without sleeping. Having had her, gone home, didn't sleep all that night, didn't sleep the next night. And then we had an appointment at 8 a.m. And I got in there and I didn't have anything. I didn't bring a diaper bag because I was like just totally frazzled. And we got in there, and the doctor took my baby from me to weigh her, and she started to freak out. She started to cry. And I absolutely lost it. I don't think that I could say any words throughout the whole pediatrician appointment because I was just like, it was just all like welled up in me. And at the end of the pediatrician appointment, which mostly my husband was the one doing the talking, because I was just like the whole time. I couldn't get it together again. And as the doctor left, a nurse came in the door, and she kind of like edged around the door and handed me a pamphlet on postpartum depression and then left. And we laugh about that so much. She was like, here you go, crazy lady. Go away now.
Do you think she could have addressed that differently? Do you think she should have addressed it differently?
Of help.
So do you think she should have addressed it differently? I mean, like,
honestly, it's a funny story, but I know that a lot of healthcare professionals, nurses particularly, are just absolutely swamped, and it's not necessarily their responsibility to fix all of the issues. I definitely could have gone back and said, hey guys, I'm having an issue, but being in the middle of a depression, all I really could do was take care of my baby and sleep. So really, I know this isn't exactly the answer that anyone wants because, I don't know, it's responsibility on them. But I really do feel like the best thing that anyone can do if they experience that is to share their experience and work with foundations, create groups, reach out in your community and say, listen, let's destigmatize, first of all, going to the doctor and asking and saying, hi, I need to be medicated, or hi, I need some talk therapy. And even if it's just a temporary measure to get you to the next step, really the work can be done in your community to help people help themselves and get to the healthcare professionals who can help them.
Thank you so much, Jay. I think your description of what you went through is really raw in the sense that I could touch it, I could feel you. It is true that I can never walk in your shoes because this is your unique experience, but the way you've described it, I'm sure it is, it has inspired some people on the comment section. That said, I just want to respond to Stella, who said, "Aha, true. When I got my first baby, I went straight to the mirror to check if the huge stomach had disappeared." I think she's responding to what Dr. Mercy said. But let's look at what Kalia thinks about the support that we can get from our healthcare professionals, because I feel that they have a bigger role to play than just sneaking around and handing us pamphlets. So, Dr. Kalia, Kalia, can you tell us how healthcare providers and support system can better recognize and address this depression and anxiety?
Yes. One, we can be more aware of how our patients are feeling or how our clients are feeling. I was a peer specialist. Well, I am a peer specialist. And one thing that we do is we connect and we share story and we hold space. I like what they said, where, she actually shared her unique experience. We have to be willing to do that. We have to be willing to connect and identify with clients how they're feeling. This mom's coming in and she is emotionally distraught, not thinking in the same sense as on a normal terms. And what is that anyway? She's clutching a little tightly to her baby. She's not put together. There's things that are missing. We have to be aware of that and stop and be more acknowledging of that. Ask the mother questions. It's okay to ask questions. It's okay to let the mama cry and we talk the mom through. We have to be willing to do that. Some parts of the profession has lost its connecting piece where we can identify these issues with clients. I've dealt with postpartum for a very, very, very long time with actually working for WIC and dealing with it myself early on in my own pregnancies. I had both antepartum and postpartum depression, and that was a very scary walk. And it took my OBGYN to say, "Hey, are you okay?" I lost it. Those three, "Are you okay?" Those three words, immediate tears to me, because I know that I wasn't. And I know that the thoughts that I had were scaring me to the point where I needed some help. I didn't know how to ask for it. And it took my doctor to say, "Okay, let's walk through the steps. Let's walk through what's going on. Tell me what's going on." That was a longer appointment. It wasn't 15 minutes. It wasn't 30 minutes. It was an hour. And I got the chance to let off a lot of steam with my doctor. I had dreams of choking my husband. I did. I had dreams of choking my husband, and it scared me to death. And not harming my baby. I loved all my babies, but that scared me. And it manifested in that humongous fear of acting and impulse. And so my doctor helped work me through. I went to the local LMHA. She placed me on medication. And I did that for I think 2 years after my son was born. But it takes a provider being willing to listen, being open to what the client is saying, non-judgmental and unbiased, and is willing to help, in that kind of awareness for what the client or the patient has going on, for us to be willing to help. We have been trained to look at these things, but we also need to be trained to look at them at a more personal and human level as well.
Wow. So when you're speaking, I'm thinking about our spirits as people, and I'm thinking about our body that carries the spirits. Sometimes we find it very difficult to separate the two, because whatever
Mhm.
goes in our spirit, it disturbs the way we react, we behave as human beings. That said, I'm just thinking about the things that you went through, especially the tantrums, especially the fatigue. Did you lose any sleep at all?
Oh, of
Oh, of
course.
course.
With my
With my
first
first
baby,
baby,
she cried
she
for three
cried for three
weeks.
weeks.
We couldn't
We
figure
couldn't
out
figure
what
out
was
what
going
was
on.
going on.
I would
I,
feed, I would clothe, I would love on, I would talk to, I would sing. I had the little lavender lotion that smelled really good, do the little body massages, all of those things. She still cried. Didn't know what was going on. I cried. I reached out to my mom, and my mom came at 3 o'clock in the morning to hold her while I got some sleep. And she did that several nights for me. And I cannot thank her enough for that. But sleep, I don't remember when I got sleep. I think it was when they were much older. And for a woman that's going through postpartum depression, lack of sleep is one of those things that we are going to go through. One, we're watching the baby, making sure the baby is breathing, making sure the baby's warm enough and not hot enough, not too hot. We want to make sure that the diaper's not dirty. We want to be awake enough to hear them cry, and we want to be attentive to that. And so we don't get any sleep because we're gonna hear that cry. We want to be there when they cry. And if they're laying right next to us, because some are, what do they call it, where they sleep in the bed with the parent, and some sleep in the bassinet on the side of the bed, but we still are awake to hear that little shuffle when they move their foot, and we look over. Okay, are they okay? Okay, I'm going back to sleep. Or we're listening for the bowel movement. We all know the bubble noise. And if it's bad enough, we got to get on up at 3 o'clock in the morning and change a whole body suit and the diaper and the bedding and everything else that is associated, put in a big trash bag, and put it outside. And because it is that bad. As a new mother, we've experienced the blowout. And sometimes it's at 3 o'clock in the morning and there's no sleep.
Well, I think you were very lucky to have your mom with you, because not everyone has that opportunity. I remember when I had my first baby, I was pretty young, and I would fall asleep right after she gets up. And I remember my mom practically sitting next to me and holding my boobs while I just sleep, and she was feeding her. So definitely can I definitely can testify that moms, but not everybody has that blessing, that opportunity. Dr. Mercy, tell us, what are some of the strategies that we can use to manage sleep and fatigue during the postpartum depression or postpartum periods?
So sometimes we need to take care of certain things before they even go down the drain, before we even get that diagnosis of postpartum depression. We already know that this new child is coming. And I don't know why most of the time it's at nighttime that they are awake. So they are disturbing your own sleep routine that hopefully you had already created a good sleep hygiene. Now you have to adapt to this baby's own hygiene. At nighttime, they are not sleeping. And most of the time, you are not sleeping. If you realize that at daytime or when the baby is sleeping, you are not even able to still fall asleep, even if you've taken strategies in place, like turn off your phone, restrict visitors. When the baby is asleep, let everything go. You too can take a sleep, because when the baby is up, Most of the time, you're forced to be up. If you are the one feeding, breastfeeding the baby, most of the time, you're forced to be up as well. So adjust to that sleep routine. Create another good sleep hygiene for you. Because when you don't sleep, you're already overwhelmed, you're already fatigued, taking care of everything else and the new baby and the new role. It brings fatigue and tiredness. Then when you don't sleep, it just adds to that. When you realize that you're having severe mood swings, it's 1 hour you're feeling this way, the next 30 minutes you're feeling this way, the next moment you're feeling this way. It's intense, it is persistent sadness. Sometimes you even feel hopeless, sometimes you even feel helpless. Then start telling yourself, like, maybe I need help. Like Jay was so anxious. That anxiety come. It doesn't mean you have an anxiety. It's just your worry. How do I take care of this baby? But when it is persistent and you have to be with that baby 24/7, every second, yes, you want the well-being of that baby, but when it is persistent, excessive anxiety, some women even go into panic attacks. They may be in the shower and they hear the baby cry and they just go into panic attacks. Then they come back and blame everyone in the house. I gave you the baby for 1 hour, you couldn't take care of the hour. And even when they get help, somebody say, okay, let me have the baby for 2 hours while you get some sleep. They hear that baby just make a little noise, they are up. They get up. They are not able to relax. They are not able to rest. They are not able to trust anybody with that baby. And this can lead to even feelings of paranoia, like, no, I'm the only one who can take care of this baby. Oh, I just fed this baby. Did you choke the baby? Why is the baby spitting up? It's because you did not hold the baby very well. It's because you don't know how to hold the baby. You start having a sense of paranoia. You start feeling insecure around other people. Now you start having moments where you're not able to bond with the baby as much as you love the baby. Sometimes you're not able to bond with this baby. You're not able to accept where the baby is in your life at that period. You know that this is my baby. I have to adjust my responsibilities. I have to do this. I have to do this. But you don't feel like you're connecting with that baby. That natural bonding is not there. It's time to seek help. When you start becoming so obsessed and having intrusive thoughts, not only is the emotional connection not there, but you're having obsession that can cause significant distress to you. Everything is about baby. Baby, what's the baby doing? Even before the baby cough, your sixth sense is already telling you the baby is coughing. Even before the baby turn in the bed, you're already thinking, is that baby going to fall? And they are in a secure environment. When you start getting so obsessed, so worried, I think it's time to seek help. Those are signs and symptoms that can trigger you. Share that conversation with somebody. You don't even trust your husband or the baby's father to be with that baby. You don't trust nobody. You are in the shower and the baby is right by the door. You are eating and you have to hold the baby. You don't even trust anybody. And it's not just anybody. You don't even trust yourself with that baby. It's time to say, I need help. And the good thing that they do these days is they do prenatal depression tests before they even do postpartum ones. So they have established that in most hospitals so that they can compare what were you before and what are you after, as opposed to depression and anxiety. Each time you go to your OB for checkup, they ask you, are you happy? Are you depressed? They try to do some little screenings. That way, if the screening is way different after birth, it can start showing signs that something is going on that they can watch out for. Because most of the time, we women, we are strong, we are alpha women, we are super women. We don't voice out when we need help. We don't even know how to accept help. So through those screenings, they can easily tell sometimes to ask those, are you okay questions? Just like Kalia was asked. To not just treat the depression or give you a piece of paper, to look at you and say, are you okay? How are you feeling? I remember when I was pregnant too, they asked in the hospital if I needed help at home, if I needed someone to come home and help. These are very good measures. Do you have enough support in the house? Do you sleep? Do you get help? All those things, they help when that baby comes, and they help with your state of mind. They help so that you can be the best help for your baby. And you're not only dealing with the baby at that time, we have so many other things we are dealing with. But let us learn to ask for help. Thank you.
Thank you so much, Dr. Mercy. I've just popped in the comments from Stella, who agrees with the fact that healthcare professionals should constantly assess their patients' mental health, and she's also, honing the fact that simple questions, "Are you okay?" can make a big difference. So I just thought that's a very good one to pop on my screen. But while we are at that, let me come to you, Jay, because obviously this is something that you've been through and it is still fresh in your memory. How do we, or how did you navigate the changes in your relationship, and what part did your support system, your support group, what part did they play in making you, in reducing the anxiety or the pressure that you felt during this time?
So, my experience was good and bad. I did actually lose pretty much all of my friends. I was the first of my friend group to start having kids. So all of my previous friend group didn't have kids, and they tried to help, but there was a little bit of a disconnect, and almost all of those people just kind of drifted away. I also moved from one city to the city that we're in now, from Dallas to Fort Worth, which is about an hour, 45-minute drive. So there was that disconnect. We moved into a new home. We moved from an apartment into a house a week after my daughter was born. So a lot of people came to help move things, and then they just kind of all dissipated. However, the support system that I did end up creating, not really creating, but just kind of like finding, was my husband's family, actually. My family is somewhat local. I say local because in Texas it takes 10 hours to drive anywhere. But my family is here. But like a 2-3 hour drive away is just far enough away that they're far enough that they can't help. They can't be there every weekend 2 or 3 times a week to come help me. But my in-laws, my husband's mother and father, invited me. My mother-in-law actually was the first person who was like, "I don't think you're doing okay. Like, don't take this the wrong way. I know I'm your mother-in-law, and that's sometimes a rude thing to say, but she experienced major postpartum depression with my sister-in-laws at a time when it was not as talked about. No one told her this is normal. What you're experiencing is normal." They also moved when my sister-in-laws were little. So she had experienced being uprooted from the place where she had lived for her entire life. And they moved to North Dakota, which was boring and cold. She didn't want to be there. So she really was my support system. And I guess the advice that I have, I don't really have great advice because I really just kind of powered through the situations instead of like finding solutions. But my advice is that really do just like the people that stick with you through those hard times, they are your people. And you like, and if people offer to help, please take the help. Please take the help. The person that Mercy is describing, I'm sitting here going, that was me. That was me. I had little baby Aurora in her bassinet, in her little car seat right next to me in the shower, not in the shower, but next to the door, because I did have serious paranoia that no one could take care of her the right way. A lot of this was because I was breastfeeding, and I was like, our dynamic, again, I'll go back to what I said earlier with my husband. He needed to work. He needed to get up the next day to go to work, and he needed to study when he got home. And some people that dynamic just doesn't work. The anxiousness and the issues start to get kind of like piled on the husband who's not doing, or the partner who's not helping. But that was the dynamic that we agreed on. But I took it too far. I did. If he wanted to help, I was like, I don't know. You're not doing that the right way. Like, I love you so much, but please stop. Let me do it. And it really did take my mother-in-law being like, listen, chick, you're crazy. And that snapped me out of it a little. And that's what I have to say.
Well, I think you were very brave, to go through that, and I guess you were young as well, having moved in a new place and having left most of your friends behind. From my experience, with my husband, when I had my son, we spent a lot of times, quarreling. I mean, maybe your husband was just cool about it. We spent a lot of times quarreling because he thought I was not good enough, to do the things that I should do for my son. So he was pretty much in the middle of everything that we were doing, and I could say the first few months he did pretty much a lot alone, and I was simply just saying yes, yes, because if not, we spend the entire day just arguing about who is right and who is wrong. As new parents, you always go through that. So you were very brave. I'll come to you, Kalia. As a coach, as a mental health coach, I'm sure you must have spoken to a lot of patients who have maybe fallen out with their partners because of the dynamics of having a new baby in that relationship. What sort of advice do you usually advise them? How do they navigate, the changes that happened in their relationship, and how do you advise them to make use of their support system?
One of the first things I normally say is, give ourselves some grace. One, we are having to understand where we are in our new parenting role. And two, understand where our help is coming from. Do we have our supports in place? Are they positive supports? Because there's a positive and there's a negative support. And then I use my own experience as a way to help them navigate their own experiences as well, making sure that they are okay to delegate. And I was a breastfeeding mother myself, and the idea of breastfeeding was I get to sit down with the baby. I don't have to do anything. You can take care of it while I sit here and feed the baby. Also, if somebody comes over, we would set up, things that they would do. There's clothes that need to be washed and dishes that need to be washed and clothes that need to be folded and can be put in a certain area. I don't want you to put everything away, but put them in a place where I can when I'm able. But, help me to organize a few things while I have this new baby. If you come over to see the baby, I'm going to put you to work. And it's okay to delegate that. Also, develop a plan beforehand. Get your support people talking beforehand. Hey, I'm looking at a wellness book. We can name it whatever we want to, but I'm looking at a wellness plan for after I have the baby. And I wanted to make sure that you're in this plan also. Can I count on you to, talk to me when I need to, or come by and see me and hold the baby a little bit, bring a dish of food, pick up a few things from the store if I call, is it okay to ask you for help? And sometimes we have to give ourselves permission to just ask. It's okay to ask. There's nothing wrong with it. We have to be willing not to be super women and power through it. Just like Jay, I was a power through. I had three under the age of 5. One in one will carry things, one walking and one crawling. And the help that I possibly could have had, it wasn't as strong as what I needed by the time I had my third child, because I had to revamp who was supportive, who was positive, and who was negative in my life. And being able to delegate that for myself, also putting dad in play. Let's put him in play. He can feed baby, he can hold baby. Mama has to have a minute. Let me go use the bathroom. Let me go take a shower. I had to take several deep breaths while I was in the shower because the baby was screaming, but I was going to take the shower. I needed it. When I got through, I had a sandwich, had a cup of milk, had my comfy chair. I got the baby. I could take a bigger deep breath because baby stopped crying. But sometimes it's okay to take our small steps back and allow somebody else to help and not take the full brunt of the responsibility onto ourselves. Sometimes it felt like a punishment, like I did this because I was a 19-year-old new mother. And so I did this. I laid down, I had the baby. I have to make sure that I take care of the baby. But nobody ever told me that I could ask for help. And it wasn't until, mind you, I have a mother and I have 7 sisters. And it wasn't until one of my sisters came to me, my big sister, told me, ma'am, ask for help. Come on, sit down. I got you. Let me hold the baby. You'll take a break. She made me a pallet on the couch, got me a pillow, laid there. The baby was quiet, had no idea. I'm 19. I don't know how she did it. But I was able to take me a nap, get myself together. And once I got up, I was able to handle more things. But when we have babies, ask for help. It's okay to ask. It's okay to delegate. And it really is okay to put people to work. If they're coming over to hold the baby, to hold this baby, I need you to fold some clothes and smile. And I joke about it, but I'm very serious.
Wow. Thank you so much, Kalia. Just listening to you telling it, that's the most natural way to say it. Also the most natural way, the most normal thing for us to do is to ask. But as Jay would say, if we are in that in that place, that deep place of depression, we always think that nobody can do it as best as we can. So we want to do it all by ourselves. So if you're watching, if you're just joining us now, I'm going to put a little video so you know what we're doing, where we are, and then we'll be back after 21 seconds. Welcome back. If you're joining us today, it's another special edition with all Mercy Psychiatry and Integrative Care. We are talking about postpartum depression, and we're talking about how we feel, as women after having our babies. As I said in the beginning, some women, even before having their babies, they've already started developing that depression, all the things that gets them anxious, with regards to how their body is going to look like, what they're going to do with their babies, if their baby is going to be okay. And now we're just talking about, sharing experiences, what happened with Jay, with Kalia, and with Dr. Mercy. Right now, we are almost walking or almost talking towards the end of our program. But before we dive to our next question, I would like Dr. Mercy to tell us a little bit about All Mercy and what she does.
Yes, All Mercy is a mental health practice. We are in Texas. We have two offices in Texas, actually, at Bedford Road and in Ray White Road. We have an office in Oregon, one in Washington, and one in New Mexico. So we do everything mental health. We have about 5 providers. We have a mental health coach. We have relationship coach. We have counselors. We have all the services that we provide for our patients and also for our prospective patients. I was at a place last week and somebody asked me that, oh, so you work with mad people, right? That place where that other office is, it looks like they are very mad people, many mad people over there. My question to him was, what is mad people? He said, like people who are crazy. That's what you specialize in, right? I said, we specialize with everybody. He was so shocked. He said, what do you mean? So even me, I can come to your place? I said, yes. If you have something going on, if you're anxious, if you're depressed, or if you're doubting what is going on with you, we always, oh, so what will you be giving me medication for? It is not always about medication. Medication is the last thing we do if we think that you need medicine. We want to listen to you. We want to counsel you. It's body, mind, spirit, whatever. We are treating the whole being. You may be going through some stress, you don't know. So that makes me feel like there's still a lot of people not understanding what mental health is all about. With mental health, we're talking about your mind. We are talking about your struggles. We are talking about your body. We are talking about your challenges, whatever is going on. And some things start as little as they can start before they go to those manic phases where you become very psychotic, where you become crazy. We can help you avoid that state. We deal with diagnosed issues, and we do diagnose your issues from depression to bipolar to ADHD to anxiety, everything mental health. We incorporate that into All Mercy. And if you are in doubt, struggling through an area, but still in doubt if you need help, we always have 15 minutes free consultations. You can always email us with what you're going through or call us. We always do a free 15 minutes consultation before we see if you really need our care. So we do everything mental health. And I like when they say, what is health without mental health? And I want to say that mental health is health. Thank you.
Dr. Mercy, I'll say mental health is a journey. Let's take the wheel and ride well together. Thank you for that, and I love the fact that someone was actually asking you that even if I come to your practice, are you going to see me? Because this is going to make me ask Kalia the next question, which is about the debates that we have over the last 2 years. I'll say two. I have seen all sorts of debates about mental health. I have watched all sort of webinars. I've listened, I've watched, and I've asked myself a question that I'm sure everybody's asking themselves. Now, Kalia, tell us, is postpartum depression real? Or is it just an unexpected pressure from taking care of a new baby? Is it real?
It's a very real thing. Do you know that 85% of new mothers experience baby blues? That's staggering. And that's just the, the over emotions, the crying, the sleeplessness. But 10 to 15% of those mothers experience postpartum depression yearly. And that's in a statistic from the Center of Biotechnology and Information. And that's staggering. That means that 1 out of 7 mothers are experiencing postpartum depression. That means that we could have a mother, for instance, I'll put it in a better perspective. I'm having a new grandbaby, and though she's only 3 months pregnant, we're talking about postpartum depression, what it looks like, what you can expect, so we can have these conversations early so she can be more aware of how she's feeling and how she can ask for help. I'm one of her support people. I want to be there in the way that I can, in the way that I'm allowed to best help support her. But for women that don't get the same conversation, that don't get the same support, that 10% and 1 in 7 births are staggering, and nothing's really said until recently about postpartum depression. And it can go on for years. It can develop into other psychological issues. It can, if it's not helped early on. That's pretty much what happens.
Wow, thank you so much. I think you've mentioned some really interesting points, and the fact that sometimes we don't just pay attention to how we're feeling inside, and some people can plainly tell you I'm a very sad person, and they wouldn't even know that that is really something that can be resolved, something that they can actually seek for help. They'll just keep on going on with that notion that I'm a very sad person, no matter how rich I get, no matter how poor I get, how thin I get, how fat I grow. I'm just a naturally very very sad person. But to be honest, people need to start thinking about getting help, and people need to start understanding and believing that mental health is real. And most of the time when a woman has a baby and she's going through all of these, as Mercy was saying initially, we've come to a point where we say, oh, it's okay for you to feel this way, it's okay for you to feel that way. That is what happens when you just have a baby. I just want to be honest that my sister just had a baby, and she named her baby after me. And there are some things that I've told her it's okay. But after listening to Jay, Kalia, and you, Dr. Mercy, I think I'm going to call her immediately. I'm going to call her, the baby is still like 1.5 months. I'm going to call her immediately after this webinar, and I'm going to tell her, sis, if you're still feeling this way, I think you have to speak to someone. I'm blessed to have Dr. Mercy, and I think right now I'm connected to you, Kalia, as well. So if you see a strange woman, calling you from Cameroon, asking you, what should I do? Know that it's my sister. So I'm going to be, just throwing people that come my way, because the fact that we're doing this means that we care about others. It doesn't matter if they pay us or not. There are certain aspect or the certain things that we can do, we can give back, as long as they're not, pulling you left, right, center. But I'm happy to have been part of this conversation, because it has opened my eyes, and now I know. Sometimes we just read these things in literature books and we say, oh, it's in books. But after listening to you, Jay, thank you for sharing your story. I think someone said that already as well. But Dr. Mercy, tell us, what are some of the valuable resources and support groups available, to women? I know that I've already said you are available, you are a support group, But what are some of those that you can comfortably share, where people can just go for information?
Most of the most of the time, those support groups differ from community to communities. So don't wait until the baby comes to start seeking where you fit in. And I see a question where Stell asks, what advice would you give single mothers? So this goes to everybody. Don't wait until the baby comes. Once you get pregnant, thorough planning starts right there. This is a huge individual that has come into your life who needs 100 support from you till they become independent themselves. So start searching. What support can your workplace offer you? I used to work where your workplace can take care of your baby, I think 7 days a week for an 8-hour period. They just didn't want people to abuse it and not plan better or go to daycare. But they will tell you that in days where you're tied up, 7 days in a month, they could help you for an 8-hour period, take care of your baby. That way you're not calling in from work or things like that. I think that is huge. Now, when you go for your OB/GYN visits, ask them what support they have for that hospital. You'll be surprised that you may qualify for some free daycare brochures. You may qualify for some free visits at home. People can come to your home, help you clean, help you arrange for like 4 hours every week so that you take some time for yourself. You go to your community, pair up with mothers who are pregnant or who have children themselves. I have seen where sometimes they just connect and say, oh, today I have a date night. This mother is the one watching all the kids. And you'll find that mother with like 10 kids so that her peers can go live their lives without the baby for 2-3 hours. And next time when it is your turn, be receptive to take that responsibility. And other supports are counseling. Sometimes you're feeling like, am I a horrible person? Why am I not connecting with this baby? You're not horrible. It is maybe your hormone. It is maybe you're tired. It is maybe you don't have no one to share that responsibility with and everything falls on you. Seek counseling. They will help you navigate through that process and especially planning. If you have a group of friends, maybe they can all come in one day so that you give them that one day and they visit with the baby, they help you clean. Or maybe that way you can rest the rest of the week or the rest of the month. Or maybe they can come different days so that they are not bringing you 10 trays of food in one day and they get bad and the remaining 29 days of the month you don't have food to eat. You can schedule them that no, these two people can come this weekend. And like Kalia said, it is not laziness to ask for help. It is not laziness it is not weakness to say, oh, I need help. When they come spend 2 hours with you, put them to work. They will gladly do it. Say, hey, my back been hurting. Hey, my titties hurt. I've been breastfeeding. But my kitchen is dirty. Can you help? Baby's laundry are piling up. Can you help? They will gladly help. Learn to accept that help and learn to ask for help. And this comes along with open communication. Communicate. Like, I have not slept for 3 nights. If you have time today, can you come bond with the baby for 4 hours while I get some sleep? If the baby cries, food is here, this is how they do this is how you warm it. And those people will not call you except they have to call you, except they want to disturb you. So learn to ask for help. Sometimes those things are there. You have great families, great friends. Why get tired alone? And you know they love you and they love that baby. Delegate those things. Especially
Thank you, Dr. Mercy. There's a question from Princess. Why is it difficult to recognize or admit to being depressed? Jay, how long did it take you to admit?
Well, like I said before, I really didn't start to snap out of it and start feel normal until after I stopped breastfeeding. But that's just my experience. I feel like a big reason why it's hard to admit or take that first step to reaching out and asking for help, or asking your healthcare provider for help, is because it is still today a little bit of an issue to say that I'm not being able to handle everything. And some people do feel like it's lazy to reach out and ask for help, for someone to come and help them take care of the baby, help them take care of the dishes or the laundry or anything that they need help with. It is tough to go from being like a fully functioning adult who doesn't need her friends and family to drop everything and come, and then to just all of a sudden, sometimes it feels like go from being this person who has everything together and then needing the help. But I don't know. That was my experience. That was definitely my experience. A big thing that helped me with that, after I started to realize that what I was experiencing wasn't normal, was to give myself the permission to let some things go. Like, really, like if the baby's laundry stayed in the basket, if I just washed it and it went right back into a pile in a basket, it was clean and it was going to get spit up on in 10 minutes anyway. So who cares if it's folded and nice and in the nursery? And the nursery was another thing I mentioned earlier. I gave myself the permission to say, hey, this is a fancy closet. It's not working for her to be all the way upstairs if I'm this anxious. We need her to be next to us in our room or in our bed. And that was that way until very recently, honestly.
Wow. Thank you so much, Jay. Thank you. Kalia, very briefly, tell us how often or how soon or how long, how often, how soon, how long does it take someone to come back to you to say, I'm depressed? Because sometimes someone might be recommended to you by their OB, and they'll come like, I don't have a problem. So have you had a case where people go, come, and then finally come and say, yes, I need help?
Of course. A lot of it, from my experience, a lot of it I get is shame. I mean, they put it in very simple terms. We are geared to handle it all. We are supposed to take care of it all. We are independent, we're strong, we can do it all, and we can take care of this kid. And we have to push aside how we feel for a moment just to get it done. And admitting that we are shamed by self. And so a lot of clients, when they come to me and they sit in my chair, oh no, I don't have a problem. Oh no, I'm okay. Okay. Well, let's talk. Let's just have us a conversation. How are you doing today? I go very basic. And sometimes I may hit a nerve unintentionally and not being rude at all, but I hit a sore spot with a parent, and it gives them a chance to self-reflect and go, okay, well, maybe there is something going on. Can I talk to you about it without being judged? Because sometimes they just need to let it out. Once you let it out, okay, let's address it. Let's sit it in the middle of the room and let's talk about it. And before we leave, we have to come up with some sort of solution that's going to work for you. And sometimes they do leave and leave before getting the help. But a lot of times they come back because they've realized that the conversation that was had helps. They were able to think about things. They're able to process things without being judged by how they feel, talked down to, or shamed unintentionally by not being able to handle, the pressures of new motherhood. And it's not just mothers, it's also dads as well. And I get a lot of dads that are feeling postpartum pressure as well. And for specialists, we have to be acknowledging about both mother and father or both parents that are
that are
experiencing
experiencing
postpartum
postpartum
depression.
depression. Wow. Mercy, Dr. Mercy, I think you would testify that this is a calmest session I've hosted where I am extremely calm and where I don't want the conversation to stop. Usually by the time we are top of the hours, I'm in such a hurry to go onto something else, but I can listen to you girls the whole evening and I'm not gonna get tired. I think this is because this conversation is something that resonates really deeply with me. It's something that I feel many women need to listen. This is such a valid discussion. Not that the others aren't, no, they all are, but this is such a precious conversation. I want to call it precious, and I am so blessed to have been able to host you guys, this session. And I'm also extremely lucky that you have given your all. You've just opened yourself, Jay. I can't thank you enough. You've just opened, and you know, Kalia, you've just opened yourself to our audience to listen to the pain that you've gone through. We cannot take this for granted. I repeat, we cannot take this for granted. Not everybody is this open, and I can tell you that many people are going to go home feeling very it's not just me. And many people who are still thinking about having a baby, they're going to think about this conversation for a very, very long time, telling themselves, okay, maybe it will help them to go seek for help earlier so that they know how to navigate some of the things that we've discussed. So I want to thank you. I know we're clocking 1.5 hours, but let's please just round up with our personal last minute message, because it's not going to be a conversation if I don't give you the floor to tell us exactly that final words that you can tell our audience. And to our audience, thank you for staying. We've been consistently growing and we've been consistently having comments on the comment section, contributions as well. So I'm going to start with you, Jay, and then I'll come to you, Kalia, and then I'll end with Dr. Mercy, who's going to wrap up the show. So Jay, if there is something you want to tell someone out there about postpartum depression, what is it you're going to say?
So the first thing I would say is just to reiterate what we keep saying. If you are feeling like you need help, please push through that depression and reach out and ask for help from your healthcare professionals, from your support system. Set it up beforehand. Like we've also said, set it up beforehand before you get into the situation that you might be in. And the other thing that I want to say, and this will be my closing remark, is it doesn't last forever. Sometimes when you're in it, it feels like these 3 a.m. rocking the baby, trying to lay her back down in her bassinet, and she just keeps waking back up the second that you lay them back down. It doesn't last forever, in a good way and a bad way. Like you will miss it, you will, but you also will get back to a point where you feel like yourself, you feel like a new version of yourself, and you will feel things start to regulate as your child gets older and as you get help that you need.
Thank you, Kali. Thank you so much, Jay. I'm going to pass over the mic, the floor, the stage to Kalia so she can give us her closing remark.
Okay, well, my thing first, allow the grace to go through what you're going through and no pressure. There already is a lot of pressure there. Two, like we've all been saying, give ourselves the space to reach out and ask for help and the permission to ask for help. I love what Jay said. Give ourselves the permission to let some things go. Let the clothes pile up in the basket. And if they come over to see the baby, have them put them in the washing machine. Have them fold the baby's clothes. Another thing is set up a plan beforehand. Have your healthy conversations with your support team, whether it's your doctor, your OBGYN, your pediatrician, your husband or baby's father, your parent, whoever it is that is in your support system. Let them know that you're going to need this extra support after the baby, and so that they can be aware as well. And remember self-care, taking a bath, making sure we're drinking, making sure we're eating, making sure we're sleeping enough, making sure we're healing body wise for ourselves, so that we can take care of the baby. And reach out to your peer support specialist for help.
Thank you so much, Kalia. Thank you. Thank you. That was refreshing. This last minute advice is what I live for. This is like you summarizing your best parts of the webinar and just giving it another push at the end of the webinar. So that said, I'm going to call on the stage my host, Dr. Mercy, to give us her final remark and to tell us what she wanted with listening. Once more, thank you guys for joining. Usually, I like to pick out names and I like to just tell people who've been on the show with us. Stella, thank you. Thank you so much. Princess, thank you very much. Munji, Eldie, Maribel, Stephanie, Malik, Layla, Rashida, Ramses, Shobi. I mean, I cannot call all the names, but I love the moment where I show our guests, our audience, that we truly appreciate their time and the fact that they've been with us throughout the 1 hour that we kept for them, and they've actually stayed for 1.5 hours. So we have 2 minutes to end our stream, and I'll pass this to you, Dr. Mercy. Thank you so much, Jay. Thank you so much, Kalia, and see you on our next live. See ya.
I am so happy. Jay said it's not going to last forever. Very true. Those moments, as overwhelming as they may be. I remember telling my mom, I cannot wait for these children to grow up. And she will respond, they are growing up. So those challenging moments are not going to last forever. And just like Jay said, you will miss those moments too. So cherish them while they last. Create little milestones with them. Celebrate those moments as you go about them. And just like Kalia said, self-care. Promote self-care. That baby has not come to steal your identity. You are still you before being that baby's mother. So promote self-care. Take care of you. Take care of yourself. Please. Many people neglect their self-care and neglect what was important to them. And that's how that starts trending away. And before they realize something is missing, something, a huge part of their life is missing. And they just think it's all about the baby, but it's because they did not promote self-care. At All Mercy, what we do with pregnant mothers or mothers who tell us, I am on medication or I am doing this, I am trying to get pregnant, what we start telling them is having an open conversation with them. Because sometimes when they meet those challenges, they are unsure if it is a problem or not. So we want to facilitate that moment for them by started teaching them early enough. Okay, you're trying to get pregnant. Okay, you're getting pregnant. This is what you can start feeling. Or after the baby, this is what you may expect. We help them integrate that planning into whatever their postpartum life may seem like. We plan, set realistic expectations, tell them to prioritize sleep, tell them to take breaks together with the baby. If the baby is taking a break, take a break. Because once that baby is not taking a break, you may not be able to take a break. Involve your partner if you have one. Draw out a clear line. And sometimes we have the partner meet with us as well before that baby comes. This is what you may expect. This is how you may see your wife. This is what your wife may be going through. So don't think that they are crazy. Don't think that they are different, but those are just signs that they may need more help and more support. We encourage these mothers, express your needs. No need. You're stronger when you say, hey, I need help, than dying inside without the ability to accept or to admit that you need help. Express your needs. Sometimes you may think some people know you too much, but are you giving them permission to help you? Are you telling them that you need help? And are you ready to receive that help? But like all of us have said, start building that support system. Hey, I'm pregnant. The baby will be here in 3 months. What role are you playing? What role are you playing? Or this is where I need help with. Or when I go back to work, I am off on these days. What days are you off? What do I expect you to do the days that you're off? And sometimes be selective with your social engagement. We teach all this to mothers before that baby comes. That way, because we have noticed that most of the time, people are not sure what they should be talking about or what is a challenge until it becomes huge. So we are facilitating that communication way ahead of time so that they can easily tell us when they have that issue. Limit your social engagements. It's not all parties that you attend. Sometimes you go pick up box from nowhere, the baby come home sick, and the baby is not sleeping, you're not sleeping. Or you miss other opportunities to be with your other children, or you miss other opportunities to take care of your other roles because you're attending to this baby who you took somewhere. Limit all those social engagements. You must not be everywhere with the baby. Also connect with new moms. We talk about that. See what their challenges are. See what they are going through. See how they are handling their situations. They may just be your best support system as well. They may just be there for you when you need them. Sometimes just venting out or getting another experience is enough for you to navigate through your own. Be patient with yourself and be patient with others. We tell these mothers, when that time comes, do not doubt yourself and do not overwork yourself. It's okay if there's a spoon in a dish, you can sleep. The house will not go on fire because laundry was not done. The house will not go on fire because the house does not look as kempt as you always want it to look like. It's okay. Relax. Go to sleep. We tell them that way ahead of time. And be patient with others. Others can do a better job, sometimes even better than you. You don't have it all. You don't have all the answers sometimes. So be patient. And it's okay if they handle a little way, go to sleep. The baby is alive. It's fine. And I will end it by saying, after you celebrate all those milestones, take your breaks together, seek professional help. If you're doing all these things and you're still feeling like something is wrong somewhere, don't wait until you know something is wrong to seek help. When you start thinking something is wrong, seek professional help, please. Thank you, Jay. Thank you, Kalia. Thank you, our audience is always being there. Thank you, Adeline, always being there. Thank you so much.